So the numbers have been good in Maryland across the state and have been that way for the last couple of weeks, really. We are a bright spot in the country where a month ago we were probably one of the worst spots in the entire United States. We're pleased to be joined now by Dr. John Chessare, who is the president and CEO of GBMC HealthCare. Great to have you on as well. Have you been seeing the same numbers at GBMC that we have seen across the state, at least the numbers we've been given from the state health department?
Well, we've been very lucky here at GBMC since the beginning of the outbreak. People in our region followed the governor's guidance. They maintained social distancing and they washed their hands frequently. So we didn't get a significant large number of cases. So today we have right now 18 patients in the hospital who are COVID-19 positive, and that's about where we've been for a couple of weeks. We are very excited about the drop overall in the state, and I think it's because people really did the right thing, and we just hope they continue to do that.
Dr. John Chessare is on board with us, President and CEO of GBMC HealthCare. As Brian Neiman just said, we're in our third WBL coronavirus town hall special. And Dr. Chessare, when it comes to advertising, getting folks information about GBMC, you have a campaign that you started trying to let folks know who might be hesitant to come to the hospital what to do, right?
Absolutely. We've been really concerned that since the beginning of the pandemic, people have really stopped coming into the hospital, and we need to reassure them now that things are safe. So we've started doing elective surgery again. You can imagine if you've been suffering with hip pain and you have severe arthritis in that hip, and it's been determined you should have it replaced, and now you've been waiting for 3 months, we want you to come in and have the surgery. Maybe even more importantly, you know that colon cancer screening saves lives. We've had a really incredible improvement in the mortality rate from colon cancer over the past couple decades because of screening. Well, during the pandemic, in the first 8 weeks, we didn't do any colon cancer screening. And we want people who, according to their age, should be getting screened. We want them to get back in here for that screening.
So do you know, like, the impact, when will we know the impact of hospitals being essentially shut down to everything else but COVID?
Well, I heard the conversation with Dr. Doran, and we're already seeing the effect of children not getting their immunizations, where we know the numbers of adults not getting colon cancer screening. So far, it has not resulted in any colon cancer deaths, but if it were to go on for much longer, it would result in colon cancer deaths. In New York City, they assigned everybody who died at home during the peak of the pandemic to COVID-19, and then when they looked more closely, they saw that people had died of heart attacks in their home because they were afraid to go to the hospital. So as the time passes and academics study these things and write papers, we will see other negative effects of COVID-19. But at GBMC, we don't want to wait for those papers. We want to be in action now. As Dr. Doran was just saying, we want to be in action now to prevent any untoward negative outcome.
Dr. John Chessare, President and CEO of GBMC HealthCare. You're talking about it in action now, Dr. Chessare. We are seeing protests all over the country, a lot of them here in Maryland. What are you doing, even though we're in a downward trend, what are you doing to prepare potentially for spikes as we see people not really doing a lot of social distancing in that?
So we are still in full alert mode. We are still not allowing visitors. All of our clinicians, when they go into any patient's room, are wearing face shields and N95 masks. Our emergency department is still seeing about 40 to 50 patients fewer per day. So we have all the capacity ready. We have a tent outside our ED. If we were to get a spike to try to further sequester COVID-19 patients from everybody else. As you know, anybody who's getting an elective procedure at GBMC must have a COVID-19 negative test within the 5 days prior to the procedure. So we have a state-supplied temporary building on our campus that we're using for that. So we are standing ready. We are grateful for the community maintaining social distancing and washing their hands, but we are ready if the number of cases starts going back up.
You talked about the number of cases, for GBMC, but I just want to make it clear that you have not seen any uptick at all, have you, since the economy started to slowly reopen and since some of the protests as well in the streets of Baltimore and other places in Maryland?
We have not seen an uptick. What I believe is that the number of cases in Maryland will continue going down and will continue at a very low level, assuming everybody does the right thing until we get the immunization. I want people to do the right thing, but I don't want them to be over afraid. Out of doors, it is going to be difficult to get the disease. If you maintain 6 feet distance from others and you wash your hands before you touch your face, you will protect yourself. We are grateful for people wearing masks because it is impossible in public to assure yourself in advance that no one will come within 6 feet of you. And again, that mask is to protect the other person in case you have the disease and you don't know it.
Dr. John Chessare, President and CEO of GBMC HealthCare. In the last minute we have with you, what is your message to folks listening from GBMC? What do you want folks to know?
Well, the message is thank you for maintaining social distancing and washing your hands. And we want people to know you are safe at GBMC and in any of our GBMC health partners, physician offices, and at Gilchrist. If you need help, please call us or please come to the emergency department if it's something emergent.
Dr. John Chessare, President and CEO of GBMC HealthCare, thank you. And once again, for our third Town Hall Coronavirus Special, the partnership we have is fantastic. Thank you very much, sir. Everybody.